Welcome, everybody. Welcome to episode number 53 of Fraternity Foodie. Wow, it goes by in a flash. My name is Mike Ayalon. I am the CEO of Greek University. We call these segments Fraternity Foodie because there is nothing like great food to bring people together. Today, we are in for a special treat. We have with us today a very good friend. His name is Dean Seneca. Dean is a recognized expert in health sciences and a global advocate for the underserved through community participation, building infrastructure and epidemiology, and leading through diplomatic communication. He supports tribal communities in their efforts to improve health on a daily basis. He was up until 10:30 last night working on it, and he has done extensive work specifically with the Seneca Nation of Indians. He is a member of Sigma Pi Fraternity and also, again, a very close friend of mine, a dear friend. So please welcome to the show, Dean Seneca.
Hey, Mike, thanks for having me. I deeply appreciate it. I love all the nice words. At some point in time, I wish my mother could hear all this great stuff,
Now you can share the video with her.
Yeah, we're just going to have to share the video, but it's all good stuff. Thanks for having me. I deeply appreciate it.
It's a pleasure. I enjoy all the time that we get to spend together. I know we don't get to spend a lot of time together, but the time that we do get to spend together, I have to tell you, it impacts me on a very, very deep level. So I cherish the time that we have. So number one, let's get into some questions here because people need to know more about you. You decided on the University at Buffalo for your undergraduate experience, and I know that you are very passionate about following the UB Bulls. So why did you choose UB of all places?
Well, in high school, I was an athlete. I was a very good athlete for the high school level, and I was a three-sport person, and one of the sports was baseball, and at that time, UB did have a hardball, a pretty good baseball team, and they were Division I. So it was because of that I really always had my sights on, going to the University of Buffalo, being, in the same city of the city I love, and supporting the UB Bulls and athletics all the way around. So that was really what intrigued me. When I got to the university, I was trying out on the soccer team. They canceled the baseball program the year I got there, or the year after. Maybe it was my sophomore year, but they canceled the program, and I ended up playing basketball because actually basketball was my first love. So I ended up, pursuing that for a couple of years in the very beginning at UB. But I don't know, it was something in high school. It was always about, promoting the university. A lot of the things that the university was known for as being a very hardcore science related school. So, I mean, it was just always in my heart that I was going to go to UB, and we were able to make it happen. Ironically, I didn't really have the grades. I really didn't have the grades to go to the University of Buffalo, and so I was able to use my athletic. I got a partial scholarship. I got some assistantship. I was able to use. I was American Indian as well to get in. So I had to use those opportunities, and I had to take advantage of it. And taking advantage of that was, I was on academic probation, so I had to get above a 2.0, and getting the good grades and really studying hard was all a big part of that package for me.
Yeah, I'm sure glad that you did get into UB and you were there. Nowadays it's even tougher to get in, I think, in terms of grades. So I think you and I probably benefited a little bit there because you try to get in now and it's next to impossible unless you have like perfect scores.
Yeah. I mean, the university has changed a lot, and a lot for the better. I do like it that many of our athletic programs are on the D1 level. We do need to get a lacrosse team. That is one of the things I've always been pushing for. I love the University of Buffalo. Uh, I love the diversity of the university. I love the city and the area. I love the Bulls. I love the Bills. It's just all a great fit for me, and that's why I ended up making my route around the world, and now I'm back in Western New York, and just pretty happy right now.
I love it. I'm also a midfielder for lacrosse, so I would love to see lacrosse at UB some point. So we'll see if that happens.
Nice.
Now, another interesting thing about you is that you decided to join Sigma Pi Fraternity as an undergraduate. So why is
hmm
Sigma Pi so important to you?
And that was immediate. One thing is diffuse in culture and develop character, right? Isn't that part of our motto? And that's what really did it for me, because as I went and looked at other groups and organizations, because I'm a very social person. I play a lot of athletics, part of many clubs, and as you kind of go into the social scene, you want to join a group that is kind of reflective of you. And me being American Indian, you kind of want to join a group that has a very diverse profile. And so I went and visited several other groups, and they all seemed very the same. But I went to Sigma Pi, and I saw a group of diverse folks over here, and I saw different racial ethnic groups over here, and I saw some jocks over here, and I saw some nerds over here, and I saw some study people over here, and I'm like, this is great for me. When I first started, my best friend was Chinese, and that's Bill Chen, and my other best friend was Dave Rodriguez, and he's Puerto Rican, and I'm American Indian, so we just seemed like a great fit, and these are lifelong friendships we have till today. So I think the big thing for me with Sigma Pi is aspect of diffusion culture, develop character. Those two lines in our motto speak the world to me, and that's why I chose Sigma Pi, because we really embrace those traits of diversity, and through that you get um, like we were talking about, you get good debate, you get good knowledge, you're able to understand different perspectives, and that just all really just built and sold me on the importance of being part of Sigma Pi.
Yeah, we both have very similar stories, and I think that's also what attracted me is to the chapter was that diversity. I loved all of it. I loved all the different opinions. I loved the debate. I mean, that was my favorite part, and I learned so much through that process. And I don't think that would have been possible if not for all of those men that were surrounding me and being able to embrace different ideas. So that I agree with you wholeheartedly. Obviously, we're from the same chapter originally. So that makes total sense, I think, when you look back at it. So
Yeah.
let's talk about it a little bit professionally. I know you worked as a senior health scientist for the CDC, which of course is the Center for Disease Control and Prevention, as everybody knows now. And you were working for the CDC for over 18 years. So that included a 6.5-week assignment as lead health scientist on the CDC Ebola response. You were on the EpiAid team deployed to Sierra Leone, Africa. It also included a role as polio task coordinator to the command that conducted technical assistance during an 8-day mission in Kabul, Afghanistan. And you were even recognized as one of the first responders to the newly discovered H1N1 influenza virus, where you provided critical endemic information to and from states, tribes, locals, and partners. So this is a huge body of work of your life that you dedicated at the CDC. So what have you learned over your time working with the CDC?
First off, I want to say that CDC has a lot of great people there. They have people that are in all different disciplines and all different academic backgrounds, and a lot of the people at CDC have empathy, and they really care about the public, and they really care about the public's health. So it was really good to be in an environment where you had a bunch of people that were committed to the betterment of health and the betterment of Americans in health. But some of the things that I was able to really learn were the technical capabilities around epidemiology, the technical instructions around toxicology, the technical aspects of doing health assessments and making a public health call. One of the things that I've said on many interviews, related to this COVID-19, is that, I used to rub shoulders and elbows with a lot of the senior science people that you see on the White House briefings, in the background. A lot of the people from HHS and CDC you'll see in the background. And I was, part of their groups. I was in some of their circles. And, one of the things I did learn is that a lot of the stuff that we do at CDC is based on a public health call, that you have to make a decision. You have to make a determination. Is this a public health threat or not? And, using the tools that you develop there, and actually doing like health assessments and consults and ATSDR, or, understanding the etiology of diseases like in cancer and diabetes, and heart disease and stroke and others. You become familiar with, these different areas of health, and you become familiar with making the correct, or, many of the safe public health determinations that we see throughout the country today. Major public health events that have happened throughout in our lifetime. One is, I would say, is taking the lead out of gasoline, in the 70s. That made a huge impact. If you notice, our gas stations aren't that dirty anymore. If you remember, before the 70s, our gas stations were really just kind of flooded, greasy pits in most places. But taking the lead, I mean, that has done a lot on emissions, that has done a lot for asthma, that has done a lot for, breathing clean air. I mean, this was a major event to improve public health. The other one is vaccinations. Vaccinations really changed everything that we do in public health, and has been able to, make huge strides in keeping people safe and healthy. One more recently that has made a major impact is no smoking in public places. Our good friend Tom Frieden from New York, who was health commissioner, came up with that, making that mandatory, and being backed by, Bloomberg, who was mayor at that time. This major public health change changed the world. And even in we're seeing it in many developing countries now, where there is no smoking in public places. So this also has had a major public health impact. To circle back, getting the technical understanding and the technical capabilities to make effective public health calls is probably my greatest learning experience at CDC.
Yeah, that's great. That's an incredible answer. And you're right. We don't stop to think about all of the decisions that have come down to make our world a safer place since the 70s. And you're right. I mean, they've had huge impact in terms of our quality of life. So I think that's great that you shared that. You're now the executive director at Seneca Scientific Solutions, which is your company. What types of work are you doing there, and who are your typical clients?
So taking my academic background, I have a master's in urban and regional planning, and I have another master's in public health. So taking those two disciplines, and I've formed my own LLC, especially after being at CDC for under 20 years. So the work that I'm engaging in is kind of healthy places for healthy people, right? I want to make a healthy place, and I want that designed and developed so that we have healthy populations. So I'm doing a little bit of everything. I'm doing a little bit of, planning work, urban and regional planning work. I have a couple contracts set up. I recently wrote a SEDS grant. That's a comprehensive economic development grant for the Seneca Nation of Indians. So I was still doing a little bit of the planning work. And then, I'm doing a lot of public health. stuff. I just signed a contract with Roswell Cancer Institute to write a paper on COVID-19. So I'm doing a little bit of that. So, my clientele usually comes from, both disciplines. And I'm finding out that many now universities are really kind of blending this concept of public health and urban and regional planning. Actually, at the University of Buffalo, we just developed through the School of Architecture and Planning. They now have a certificate program in planning in public health. So I'm really proud of the university because many aren't doing this. I mean, they're kind of, I thought I was on the forefront of really this concept, but no, they've embraced that as well. And I think maybe that's just the good training that we received at the university, that, forward thinking, solving complex problems, developing innovative strategies, this is kind of the next wave. I think this is definitely the future of, healthy places for healthy people. So, so that's the work that I'm getting involved in. That's the work that I've been doing, or want to do. I would like to get more involved in research, to actually research place and its impact on public health. But right now, as you know, and we all know, we're all halted on any of these kind of future projects and things. And right now, mainly what I've been doing is just focusing on COVID-19. And what I do all day is I provide technical assistance to our tribal nations, really, some state health departments as well, regarding, the etiology of COVID, the coronavirus. And, so I've been in discussions regarding a little bit of everything, prevention. One is, what are the signs and symptoms, testing. I think I'm overly well versed in testing and can tell you exactly the kind of tests that we need to conduct. Providing healthcare training for our healthcare workers. So getting our workforce, the people on the front lines, as trained and efficient and knowledgeable about COVID-19 as possible. I've been doing a little bit of that. I've also been providing a lot of technical assistance in the area of teaching tribal nations on how to set up emergency operation centers, and some of the things that you should be looking at as well. Issues addressing our elderly populations, and trying to do everything possible so our elderly populations are not exposed to this virus. I also been addressing several things regarding pre-existing conditions. I've also been talking and getting our tribal nations to understand what does that mean, and how that having those pre-existing conditions, getting infected with COVID-19, and the potential implications related to that. So I've been doing a little bit of training in this area. I've also been doing a little teaching too. I've actually had a few high school classes and a couple college groups reach out to me, and I've done a little bit of teaching in this area. So I would talk about American Indian health disparities, kind of laid a foundation. I'd start out with, my presentation is what is public health? And then from there go into, some major events. What are some health disparities of Native people? Then I go in, I would talk a little bit about my Ebola experience, and I have some really nice charts and graphs and tons of pictures. Kids, students love pictures. So, and those presentations have gone over very well. So that's, so right now my LLC is just focusing on COVID-19 and the response. That's what I've been doing.
Yeah, you're a fantastic resource. Hopefully people listening here, if you have companies or schools or cities and states even that are looking for somebody who's an expert from the CDC to help them with some of their COVID-19 planning, I think you would be the perfect match. So hopefully you're going to get some questions and some other follow-up following this interview once it goes all over the world. So that's fantastic. Let's talk a little bit about COVID-19, because the world is obviously dealing with this right now. The issue that I have is that we get so much conflicting information as citizens. So when I go to the grocery store, for example, in the Nashville suburbs, half of the people shopping are wearing masks. The other half of the people right now are not wearing masks. So what
Mhm.
is the right approach in your opinion, and why do you feel that
Well, I'm always going to caution on the safe side of public health, right? So, in my opinion, everyone should wear a mask, at least right now, while the virus is really, spreading and making spikes in many different areas. And actually, Mike, I'm glad you asked this question because as recent as 2 weeks ago, we're really seeing this hit rural America or hit the suburban parts of America. So right now is when we're going to see these increases in cases and things. So, sorry about that. So, it's very, very important right now to wear a mask and to practice safe social distancing, especially in those areas that are outside of the urban centers.
way?
Like right now, I would say about 2 weeks ago, we really have started to see this spike and this climb in many of our rural parts throughout the country. Um, I think we did a very good job in flattening the curve. I thought we could never do it, actually, because I
Mhm.
never thought America could actually stay isolated and stay home, stay safe for as long as we did. I'm really surprised, actually. But as recently as things have opened up, and people have kind of revolted, this is the America that I know, and this is the America that I thought we would see in the very, very beginning. So I want to say that I'm really proud of us as Americans for how well we've done. You know, we went 5 weeks. I just wish we could have did another three. You know
Mhm.
what I mean? I really wish we could have did another three. Um, but to answer your specific question, no, we really do need to wear our masks. And it's not only to protect your health, but to protect other people's health. It's to protect the health of the people that are not wearing those masks.
Mhm.
And I understand there's these things about my freedom and, what about my rights and all that? Well, what about the rights of others? We all have to like get away from our individual rights for a minute here and understand the rights of the collective good, because it's your actions, it's my actions, it's everybody's actions that really dictate the spread of this.
Mhm.
And we don't know right now who is going to get really sick, who is going to die. We're learning this right now, and then we have people that are infected that are asymptomatic, they're not showing anything. So there's a lot of unknowns here. So when we have a situation where there are a lot of unknowns, we need to practice and we need to be on the side of safety. And safety says, wear your mask, suck it up a little bit, while you're in close spaces. Once you get outside, get to your car or whatever, you could take your mask off.
Mhm.
And if we could just kind of go through these uncomfortable situations just a little bit longer, I think that'll help with the spread of this virus tremendously.
Yeah, I think you're right on. So that's excellent advice as far as I'm concerned. Let's talk about some of the universities, since obviously you and I do all kinds of work and very close with universities. Universities right now are considering whether or not to open up in person in the fall. Just recently, the 23 colleges in the California State University system recently announced that they would be primarily online in the fall. We also have other university presidents that have announced that they will open their physical campuses to students in the fall. And generally, in looking at some of their comments, they generally mention the fact that young adults have a very low death rate due to COVID-19. So, in your opinion, what is the right approach for college campuses to take regarding the fall?
Again, I'm going to caution on the side of safety.
Hmm.
So I would say in situations like California, um, and some states like New York, California, Texas, Florida, we might want to go to the online system of doing classes as much as possible, right? You will need some interaction. It's just that's the way our academic system is today. But with some other universities, that maybe in more rural areas where their case counts are low, it might be fine to open up, just as long as you also put some other things in place as you're opening up. Maybe you want to have class sizes where everybody takes every fourth seat in the auditorium. You know, if you have a big auditorium, you only have about 30 people, everybody, you know, every third seat, you know, those kinds of things. You know, everybody wear a mask in here, in the classroom kind of situation. When you get out of the classroom, you can take your mask off. Or, you know, make sure that everybody is definitely practicing hand washing, you know, and that is so important. It is unbelievable, you know, how much hand washing really does prevent the spread of viruses and germs. And that is, you know, but really taking the time to wash your hands, 20 seconds, which is a long time, believe it or not, when you're washing your hands, and to get the tips of your fingers and your thumbs. These are very, very important things. So, you know, given some situations where the virus has not really impacted that county or that state, and there are many throughout the country, it might be okay for the university to open up and try to put policies in place in order to protect and stop the spread of the virus. I don't see a problem with that. But monitor that daily. You know what I mean? We're really going to see, since we've opened up last week in many parts of the country, and then this week, many parts of the country, we're really going to have to wait another 14 days to see if we see any spikes, or to see if we see any kind of sentinel events or anything that we really need to be concerned about as we open up. So yeah, it's really too soon to tell, you know, just us opening up preliminarily like we have as a country, what the case counts are going to look like. So I think you need to really be very, very cautious. In my opinion, you know, many of the people saying, well, the young people don't die from the COVID-19 and that's okay. That's not a good statement or gauge to make a decision on. It's not that. It's the young people spreading it to the old people that is the gauge to really be considered about, because most people that are getting COVID in their homes are not getting it from them leaving. Most people are getting it from people coming into their home who've also been exposed. You know, so we're seeing a lot of that. We're seeing a lot of exposure between urban and rural areas because people are interchanging. And then also, you know, when people go into homes and stuff and deliver food and resources and things, they're also, in many cases, we're finding out are transmitting the virus. I really do think that the colleges really need to do a self-assessment and make a determination. And I could help with that assessment. You know, if colleges want someone to kind of, I've done this with some casinos actually in Indian country. You know, they wanted me to review their plans for opening up. They wanted me to review their PPE for all of their employees. They wanted me to provide training on how to properly gown and dispose of PPE, and I've done that. You know, I could do that with college campuses too, to kind of review their plans for opening up. And again, that would take, you know, some surveillance around the surrounding area. You know, who is the clientele? What does the population look like? You know, and then we could put some protective measures in place after they've made some decisions.
Yeah, you'd be an excellent resource for that. There's no question in my mind. And I'm also glad that you mentioned that we really have to wait 14 days to assess what this opening really is going to result in. One of the interesting articles that I read in the New York Times, and it was some Israeli scientists that were talking about this, they were proposing essentially a 4-day in-person, whether it be in work or in school, and then 10 days remote, because of that 14-day window that you just talked about. And I thought that was really smart, that there are ways that we can open the country in a smart way, knowing what we know about that 14-day cycle.
Yeah, it really is baby steps, Mike. I mean, we really have to really, you know, one of the biggest things that we did effectively during Ebola is, you know, when we got there, we realized we had a bunch of firemen ready to put out the fire. And there were firemen all over the place. But none of the firemen knew how to put out the fire. So what we did as scientists, we kind of, and I think that that's what others should do as well, is let's step back, you know, let's step back, let's think about this. And I got the chills a little bit, I'm remembering what we did.
Mhm.
Let's really think this through, you know, get your best and brightest people to the table, get your best scientists to the table, get your best health professionals at the table, but also get other folks at the table, get the community members, and get some people that are involved in business, and get some people that actually are working in some of these industries to the table. You know, put together a select group that you're very confident with and discuss this theoretically. You know, we're going to open up, and here are some things that we need to really address. Here are some things that we need to understand, and here are some policies and things that we have to put in place. But the key to this is messaging. You know, there are no secrets, and that's what gets me a little frustrated. You have to tell the public what is going on. You know, you have to tell the public that this is what you're doing, and engage in a dialogue with communities. You know, I really like the idea of what Cuomo did, for example, in New York. I mean, he has a daily briefing every day at, I don't know, 10 a.m. or whatever it is, and he talks for 2 hours. Listen, all of my friends in California listen to him more than they listen to their own governor. You know, I mean, it's just, it's crazy, but messaging is so important. So messaging has to be a part of the components in which you want to open up, or the changes that you want to make. It's so important. It's so important.
Yeah, I really like that answer. That's excellent. Let's talk a little bit just about fraternities and sororities, because I'm sure we have a lot of them, these members that are listening right now. They're going to have their share of challenges this fall. And I'm sure you remember what it was like being in a chapter, and, you know, the close proximity you were to all of your fraternity brothers. So what's your best advice to, let's say, chapter presidents as they approach the fall semester and they start thinking about engaging with their other brothers and sisters, and even recruiting new students? I mean, what would your advice be to, you know, 18, 19, or 20-year-old Dean Seneca if this was
Oh
happening?
God. Oh God. Um, Safety first. You know, we really have to think safety first, and turtle pace wins the race. I mean, it really does. I mean, I think that these two things are very simple concepts that, you know, our young people will, you know, embrace. They might not fully understand what that means, but they will be able to embrace it, and move forward. So, you know, our young college presidents, our young fraternities, you know, they have to think about innovative ways to be able to, come together. You know, maybe they have meetings, but the meetings are held outside in a field, far away, where they could all safe social distance, and at the same time hold a meeting, you know, where they won't be bothered, for example. And, or, you know, how are we going to have activities in order to get people to join? Okay, maybe they do things online. You know, one of the things I'm not totally in favor for, but I do see that people play video games now amongst each other, you know, in different, you know, houses and different rooms and different parts of the country and everything. Maybe there's something that they could do online in which, you know, they could bring people together. I think that that would be very, very good. But also volunteering to help, you know, in this. You know, I mean, I think you know, getting our reputation back up as the stellar group that you and I both know Sigma Pi is, you know, maybe the local fraternity does some functions in the local community to help in response to the COVID-19, you know, delivering packages to the elders, or cleaning and sanitizing many of the halls and buildings and stuff on campus. You know, maybe that, you know, people can get, you know, some additional monies, or some, you know, annuities, or some honorariums for that, or even some free food, you know, to help out, you know, around them. I think that there's a lot of things that our chapters can do to be effective and helping to support the response regarding COVID-19. You know, our young people are very energetic. You know, it would just take a few training classes to teach many of them to be contact tracers. Maybe because of this COVID-19, they were once in law, pre-law, but now they're in pre-med. because they understand these outbreaks. So I would say, don't use this COVID-19 as a deterrent. Use it as an opportunity to really, expand Sigma Pi fraternity's ability to reach and improve health.
Yeah.
Maybe all of a sudden, Sigma Pi, we graduate a bunch of doctors, because of this, because, we have people that want to help, and it changes their whole profession. It changes their whole career and whole outlook.
Yeah.
So that would be my message to our young people. Use it as the opportunity.
You shared some great opinions there and ideas. Imagine, chapters around the country being trained to be contact tracers and having whole chapters of contact tracers to do really necessary and needed work that they're giving
Yeah.
back to their community. They're learning a new skill. And think about the positive PR that would be attached to something like that. I mean,
Yeah.
that's gold in terms of giving back to their community and really what being in a fraternity is really all about, right?
Exactly.
And
Exactly.
if I'm an undergrad who's not affiliated with a fraternity or sorority and I see that, I say to myself, man, I want to be a part of that movement. That sounds really
Exactly.
cool. I want to join that. And that it gives me reason to join that has absolutely nothing to do with, parties or social events where we're all going to be
Mhm.
bunched up in a tight room with
Mhm.
100 people. We're actually going to do something to help this generation and future generations, and maybe a bunch of doctors becomes of it, right?
Mhm.
I mean,
Yeah.
it's amazing what could happen.
Exactly. Exactly. And that could help increase and put some of our chapters back on campus.
Hmm.
For many fraternities, that could help build
Hmm.
a lot of momentum.
Yeah.
It would be great, because many of our Greek organizations aren't really fully supported in many of our universities. We're talking about. And what a great thing for many of our fraternities and sororities to take an initiative like that, to do things like contact tracing, education, and safe distancing, and really go out into the local communities and support the local public health departments. I mean, what are the universities going to say then?
Yeah.
They'd have to say, "Oh my, thank you, sororities and fraternities for doing all this great work and for really taking this initiative."
Yeah.
The results would only be positive.
I agree. And a fraternity and sorority, they're great at building relationships and they're great at building rapport with people very, very quickly. So contact tracing, I mean, that's like made for fraternities and sororities, right? So I
Yeah,
hope that people take that idea and run with it. And maybe if they have questions, they'll send you some emails. But I think that's awesome.
sure.
I think that's really good. Now let's talk about the Native American population because I know you've done a ton of
Mhm.
work there. How is COVID-19 affecting American Indian reservations versus the general US population in terms of infection rates?
Well, right now, that's all over the news. We really see the Southwest, in particular, the Navajo Nation, which is the largest land base territory in the country for American Indian, Alaska Natives, American Indians. Um, so, Navajo Nation, the Albuquerque area, the Phoenix area, Arizona, they're hit really hard.
Mm.
And I just saw a report that per capita, that the infection rates at Navajo Nation are higher than California and New York, or they just surpassed it. I haven't checked into the data related to that, but this is what the reports are saying. So that part of the country has really been hit hard, and it's awful what's going on there. Actually, many of the people that I was talking with late last night were from that area. So that area is impacted heavily. But as far as the other parts, we're just seeing many cases, but not many deaths. So the rest of Indian country is faring out all right, I would say. But we are seeing an increase in infections. So the Nashville area, which includes all the tribes east of the Mississippi, we have seen some elevated numbers. The numbers have gone into the triple digits now, and usually we're staying in the double digits for a very long time. In Portland, we're seeing some areas that are showing some increases in triple digits. Oklahoma, we've seen a little bit, but every place else is faring out okay. Now, with that said, just like I was saying before, this is really just hitting rural America, and rural America is where Indian country relies. I will also say, though, the indigenous populations in Hawaii or Native Hawaiians are also being hit very hard as well, and they're seeing high um, mortality rates as well. So, you know, so we're seeing a little bit. I am thinking that that hopefully we're able to keep those numbers down low. We're able to keep the deaths down low, but we will see. We will see. Like I said, it's really just a little too early to tell. I think we're going to have to really review everything for after another week, and we'll see what the rest of Indian country looks like. But it definitely has hit the Navajo Nation very, very hard. Has hit the Hopi Nation very hard, and many of the Pueblos in New Mexico, as well as some of the Apache tribal territories in Arizona. So that's what we're seeing right now. I read the situational awareness every morning from Navajo Nation, and for example, they just had another 100 cases, but only 2 deaths today, versus many more that have been um, many higher numbers that have been discussed in the that have happened in the past.
Yeah, well, I'm happy to hear that death rate is low, and hopefully that can remain low with your help. Man, they're lucky to have you as a resource, and hopefully that the death rate stays really low. The one other question that I had for you that I have to ask, when you look at the different waves of, let's say, the Spanish flu in the early 1900s, which I know you're very familiar with, many of those graphs, they point to this bigger second wave that is possible with these types of pandemics. But back then, they didn't have the communication channels that we have today and all of the advances that we've made in science since then. So in your opinion, is a second wave perhaps this fall something that is possible or even probable for COVID-19?
I think it's very probable. I think so. Many of these things kind of have these circular kind of events, and we kind of see this repetition. So we have to prepare. We have to assume that, a second wave is coming. Now, how we handle the second wave, given all the new technology, is another point to be considered. I don't think the second wave will be as strong if we are on the forefront of fighting it once we understanding that cases have spiked, or that we've seen a wave coming in. I think we could easily go to really, emphasizing safe social distancing and doing all of our protective measures as possible. I think that will really very significantly reduce the spread of the virus and reduce deaths. But Mike, this, the way to really address all of this is to do, enhanced testing. South Korea, I think, is the gold star example of what to do. And they are testing and testing and testing. And through testing, you'll know if you have the virus, if you have the antibodies, and if you don't. And if you don't, you need to know to be extra protective. If you do, you also need to be extra protective. But we're learning that you may have plasma and things that could help others. But you really need to. The only way you'll know this is to know, your status as far as COVID-19. Have I been infected? Was I sick, and or not? And that's the whole goal here. I mean, as we continue to wrap up tests and we continue to do more and more testing and have this available to everybody, this will be a huge game changer in controlling the outbreak of this COVID-19. So, Yeah. So, I mean, and this could help answer a lot of questions.
Mhm.
Going back to your university question, if the university wants to open and they're in a safe area, but they have ability to test, oh my God, go ahead and do it. That would be
Mhm.
great. That would be, you'd be able to tell, those folks that maybe would have to take the classes from home versus those folks that could actually go into a setting and feel a little bit more secure, because they do have antibodies, to help fight off the virus.
Mhm.
Now, we don't know how long the antibodies are good. We're still learning that as we go, but still, I mean, these are huge predictors. These are huge outliers, in understanding and knowing, that could, um, help us open up, help us get the country back to its new normalcy, what I like to call it, the new normalcy. I've been saying on many of my interviews that, literally 9/11 made us aware, but COVID-19 will make us prepared. And we really realize, for example, how we are not prepared. And just another note, and I don't want to go into this, but I made some bold predictions, and it was in Indian Country Today and many other newspaper publications. And they asked me, "Are we prepared for this?" And I
Mhm.
was, hemming and hawing, going, well, we're kind of, I didn't like. I'm like, well, we're kind of prepared. I said, well, let me do some homework, and literally I started reading up and I started reading, more and more about this virus. And then I read that there's 20,000 cases over in China. And then I literally, after I read that, I was like, oh my God, it's already here. You know what I mean? I already knew things, and I literally called Indian Country Today right after, and said, we are not prepared, we are not ready, and so I made some bold predictions even before the nation's experts came out and said, we're not ready for this. Um, a little flack. Some of my colleagues were really upset that I did that because, they were coming. They said, "Don't say that about us." They were coming from the funding perspective. Like, we want to show that we are valued and we have the ability to respond in these kinds of things. But I was really coming from the pandemic perspective,
Mhm.
saving lives and things. And I understand where they were coming from, and I didn't really want to, um, disrupt their opinion or their perspective on this, and I didn't mean to do that. But in the end, I was right. We were not ready, for this. Um, so now, I think, we all have a role to play. We are there. There are many groups that are getting ramped up to. The whole country's on alert now, fighting this thing. So, we have a lot of work that we're doing here. Um, Related to not being, oh, I had a point. I don't know if you're able to edit that, but there was a, there was a reason why I was pointing out that we weren't, anyways, we weren't ready for this.
That's all right.
I think
I
it
listen.
was
I
related
totally
to
agree with you. I think that testing is the way out of this, 100%. So I agree with you completely there.
Mhm.
And it's also interesting because you wrote about the fact that we weren't prepared. Another guy who I've interviewed on Fraternity Foodie, his name is Dr. Louis Profeta. He's one of our speakers at Greek University, and he's an ER doc in Indianapolis. And he also predicted the same thing in writing. And he pointed it out. Here's in writing where I was talking about the fact, years and years and years ago, that we are not prepared for the next pandemic. We don't have the PPE, we don't have the ventilators. And what he was scared of is ultimately his worst fear was that doctors were going to have to make that choice of life or death, just by looking at a patient or their age or their underlying health issues. And he didn't want to be put in that situation. And he was
Yeah.
literally writing about it and warning about it years and years and years ago, and
Hmm.
nothing was ever done.
And my point to add to that, I just remembered what I wanted to say,
Yeah.
is that, when we weren't prepared, we're realizing now how important it is to manufacture and make things in this country, and I think that that's going to be a major shift. You're going to see many more companies now making things here and not having to rely on China or another country to get our PPE and other essential items that we need to have. We need to have this, and we need to have access.
Yeah.
So, being prepared, that's what I wanted to say, this COVID-19, you can bet after this, we're going to have, our stockpile is going to be stocked. Every hospital will have its own stockpile.
Mm-hmm.
You will see that we're never going to put ourselves in a situation where we don't have enough PPE, where we don't have enough ventilators, where we don't have enough test kits, where we don't know the chain of command, and who's in the leadership role and who's not. These are major things that we need to go forward with. So I'm glad I remembered my point.
Yeah, it's a very good one. It's a great one. Hey, you know that we love to eat good food here at Fraternity Foodie. That's no secret that both you and I love to eat good food. So what is your favorite place to go and eat in the Buffalo area? Our listeners are dying to know here.
Okay. Well, my favorite place is Chef's. Right on Seneca Street. Hey, look at that.
Hey, Seneca.
Chef's, yeah. Chef's on Seneca Street. I love that they have a spaghetti dish with the cheese all over it. I'm trying to remember the name of the dish, and it's really just right on the tip of my tongue.
One of our listeners is going to tell you the name of the dish, and you're going to be like, "Oh, that's what it was."
Yes, it is. It is. No, that's my favorite place. I always love going to Chef's. I love seeing the celebrities there. They always have a very positive atmosphere. They have great salads. I love pasta. I always get their spaghetti, meatball, and a sausage. And I like to do a lot of my lunch engagements there. So like if I have a lunch or I have an important meeting with somebody from the university or, somebody from the city, we'll always meet there. So it's all great stuff. But I love Buffalo anyways. I mean, we have a ton of great food. I mean, we have the best food, for you. Now, a lot of it is not good for you. I mean, but we have great food. I'm not saying, I mean, great tasting food, a little high in fats and salts and all of those things. I mean, we have great food. Now, is it the best and healthiest food for you? We won't go in that direction. But I love the food. So
here's a little known fact is that when I first was at UB, I was staying in Governors in the dorms, and in Governors they had the food, the restaurant was in the basement. And so every day as a first semester freshman, I got hooked on these buffalo chicken finger subs that they had down there. And I would eat one of these subs a day. And before you know it, I put on the freshman 15 and I'm like, what's going on? And then I'm like, oh yeah, I'm eating a buffalo chicken sub every day.
Yeah, I love that. I love those buffalo chicken wings, chicken fingers. You put the chicken fingers in the red hot sauce. You get those nice and going, and then you still got the mayonnaise. The lettuce, tomatoes, onions, a little jalapeno or hot pepper. Oh my God.
Oh man, that's it. I'm in heaven. Man. I am just in heaven. But luckily, I've been doing well. I've been cooking from home lately and working out like crazy. So I'm actually in the best shape of my life right now. So things can turn around for you.
Great. I haven't been able to work out, but I have been just behaving, and I really have been keeping my senses and wits upon me. Haven't had a drink since March 5th.
Good for you.
So I feel very just energetic. I feel motivated. Feel very positive. Trying to be very positive. Keep a good mind. Keep a good head. And embracing your spirituality. I'm feeling good too, brother. So
that's great. That makes me really happy to hear because I care about you. You're important to all of us in terms of dealing with this COVID-19 pandemic and whatever lays ahead in the future. So you're important. Your health is important. You're important to me, and you matter. So just know
You
that
too.
from me. Yeah, you're
You do
very,
too, man. You do too.
I appreciate that. Hey, listen, where can our audience go to connect with you if they have other questions? Maybe a school is listening and they want to run their COVID-19 plan by you. How can they
Yeah.
connect with you? Maybe a social media, a website.
Mhm.
Where should they go?
Well, I am always on Facebook, so you could message me there. But I would say go to my website, Seneca Scientific Solutions Plus. You just go there, SenecaScientificSolutions.com.
Mhm.
And through there, there's a way to call me and message me. I will get um, both the emails and the phone calls. And, we could just go from there. I'm willing to answer any questions related to infectious diseases or COVID-19 or infectious diseases or public health,
Mhm.
but also related to, urban and regional planning and what we're trying to do in the region.
I appreciate that.
I've also been associated with the city of Buffalo and their planning department and this movement on Just Move or Move On, I think they call it. And it's a really good project, a really good group. And it's just making walkability in the city and in the suburbs and many rural parts, making walkability a very important of everyday life. So that's a good project and thing. So yes, Seneca Scientific Solutions Plus. And, I would be more than glad to engage with our listeners and talk and answer questions and help address and support and promote, healthy places for healthy people.
I love it. I love it. This was great today. I always appreciate catching up with you. I always feel, lifted and I feel better every time that you and I get a chance to spend time together. So I
Same
appreciate the
here.
time that you've spent here. And thank you. Thank you so much for
Yeah.
what you've done here and continue the good work on COVID-19. I look forward to getting some updates from you in the future.
Okay, great. Mike, hey, thank you. And you keep up doing what you're doing to support our universities and to support Greek life. It's critically important for all of our futures. Who would have known that back then at that time that, looking at all the young men around us, that we would all be future leaders.
Yeah.
And many of our young people now in the university system within our group Greek organizations need to understand they will be the future leaders for tomorrow. So good work.
Yeah, I agree completely.
Hats
That's
off
why
to you too.
that's why I continue to champion Greek life, and I will for the rest of my life. It's something that I believe in. I think it gave you the leadership skills that you have today in creating your company. Certainly gave me the leadership skills that I needed to create Greek University and start this movement. And it's been great. So I owe a lot to all those relationships. So this has been great. Thank you so much. And thank you to our listeners. If you found some value in this conversation today, please like it and share it on social media so more people get to hear Dean Seneca and some of his wise words. And we look forward to seeing you on the next episode of Fraternity Foodie. Bye for now.
See you later. Take care.